Although dotamine is normally given to large animals for its inotropic effects, in cases of inhalant anesthesia-induced hypotension, chronotropic effects often predominate in cattle. Ruminants don't tend to show the baroreceptor-mediated bradycardia that may be seen in horses, nor do they commonly show any of the other electrocardiographic changes listed. Xylazine causes marked diuresis due to suppression of antidiuretic hormone secretion and hyperglycemia and may cause bladder rupture. These patients also often have marked abnormalities of hydration, acid base balance, and electrolyte status, making them less tolerant of the cardiovascular depressant properties of xylazine. Only toletamine, zolazepam, and mannitol are in tilazole. Unlike in some other species like cats, in pigs, it is the benzodiazepine zolazepam rather than the dissociative toletamine that prolongs recovery from anesthesia. Xylazine has an oxytocic effect on the bovine uterus in the last trimester of pregnancy and may cause abortion. Interestingly, ditomidine, another alpha-2 adrenergic agonist, doesn't seem to have doesn't seem to have this effect. The other three agents listed provide acceptable non-analgesic sedation, although diazepam is not normally used for this purpose in adult cows because of expense. Dobutamine, a positive inotrope, is normally administered for its beta-adrenergic effects on the heart to increase stroke volume and blood pressure. The alpha-1 adrenergic effects are minimal, so although some splenic contraction may occur, systemic vascular resistance is unaffected. The beta 2 adrenergic effects are also minor but certainly wouldn't produce bronchoconstriction, as beta 2 adrenergic agonism results in bronchodilation. Occasionally, as blood pressure improves in response to dobutamine, horses show transient reflex bradycardia. Urine production would be expected to increase or stay the same as blood pressure increases in the absence of renal vasoconstriction. Decreasing the volume and rate of fermentation in the gut minimizes the reduction in functional residual capacity that occurs when viscera impinge on lung expansion in recumbent horses. Regurgitation is very unlikely to occur in this species unless there is gastrointestinal obstruction. Flushing out the mouth, followed by tracheal intubation, is a more effective way to prevent entry of food material than is fasting. Atracorium is a competitive, non-depolarizing neuromuscular junction blocker that is useful to ensure a central position of the eye in the orbit during intraocular surgery in horses. Extraocular muscle paralysis precludes nystagmus. Atracorium doesn't provide analgesia, influence steering or change pupillary diameter. Fresh gas flows in a to and fro system are the same as for a circle system, so low flow rates may be used but are not required. Gases pass through the carbon dioxide absorbent material during both inhalation and exhalation. These low resistance machines are suitable for use with potent volatile anesthetics. Sensation usually returns quite abruptly within 5 to 10 minutes after tourniquet removal. Hematoma formation is a potential complication because the anesthetic is injected into a vein distal to the tourniquet. Use of a small needle and manual compression or a second tourniquet helps to prevent this. The local anesthetic should be free from epinephrine and other additives. Generally, 20 minutes is considered a minimum time for tourniquet placement to avoid release of a bolus of local anesthetic into the systemic circulation. Patient positioning depends on convenience and other safety factors. It doesn't affect blockade efficacy.